And we will also continue to call for accountability amongst professional medical associations who are putting a political agenda of abortion on demand for any reason without any regulations ahead of good medical care and ahead of sound science. And so we will continue to push for those associations to be held accountable this year as well.
Hello and welcome to Caring for Both, a curbside consult series by the American Association of Pro-Life Obstetricians and Gynecologists. On this podcast, we bring on experts who can provide insights to support you as a medical professional in your life-affirming practice and your life-affirming career. I'm your host for today, Miriam Diallo, Communications Manager at AAPLOG, and today I'm here with my lovely co-hosts, board-certified OBGYNs, Dr. Christina Francis and Dr. Susan Bain. Dr. Francis is AAPLOG's CEO, and Dr. Bain is the Vice Chair of our Board of Directors. I want to wish you all a Happy New Year. And to kick off 2025, we wanted to offer a look back on all that we were able to accomplish in 2024 and a look ahead at what's in store for 2025, both at AAPLOG and on this podcast. So, ladies, thank you so much for being here.
Thank you so much. It's good to be with you, Miriam.
Absolutely.
Hi, everyone.
Hi, Susan. Let's just start off with a quick, simple question. You ladies have each done several interviews for this podcast over the past year. So which were one or two of the episodes that you were each a part of that most stood out?
Well, I think, we had so many great episodes in 2024, and I think, unless I'm remembering it wrong, that it was our first full year of content. So there was so much good content to choose from. But there are definitely a couple that stand out in my mind. I think just because of maybe personal meaning for me, but I think they were probably really helpful for others too. One of those was the interview that we did with mom Aziri Perez, who shared her abortion pill reversal story. And I think this one just really stood out to me. One, because abortion pill reversal is such an issue that is near and dear to my heart. And I'm so honored and privileged to be an APR provider and get to be with women in those times when they regret their abortion decision and trying to save their babies' lives. But also because Aziri's story, I think, was really meaningful in that she knew, like many women do, right away after taking mifepristone, that she regretted her decision. And she went to a place that she thought would have the answer for her. She went to her local emergency room, not knowing where else to go and thinking, doctors will know what to do for me. They'll know if they can help me. And she found what I think many women find, in that she found a physician not who was opposed to abortion pill reversal necessarily, but who simply didn't know anything about abortion pill reversal. And so, to me, that was not only affirming of what I've heard from other people, in a similar story to what I've heard from other people, but also I think emphasize so much the importance of one of the things that AAPLOG is doing, which is to inform physicians and other medical professionals about abortion pill reversal, that it is available, that it's helpful for women, that it's life-saving for their children, and also informing people about the science that exists, that, the scientific evidence that supports abortion pill reversal. And this is so crucial and important, especially in this time where abortion pill reversal is under attack across the country in many states. And, many organizations like the American College of OBGYNs are attacking needlessly this life-saving treatment. So Aziri just really stands out in my mind. I would be remiss if I didn't mention that she also is featured in AAPLOG's new medical education video that we just released on abortion pill reversal, where she shares her story as well, which I think is so important. I think it's good for physicians and other medical professionals to hear not only the scientific evidence that upholds APR, but also to hear from women who have benefited so greatly from the availability of APR, and especially hearing from her why it's so important that more physicians know about APR and provide it so that women like her can access that life-saving treatment. So I know you asked for a couple, but I just talked for a long time about that one. So I'll let Susan share one that stands out for her.
Yeah, that makes sense. And speaking of APR, Christina, you mentioned that APR is evidence-based, and that's something that we really want medical professionals to know. And I would say probably one of my favorite interviews to be a part of was with a researcher who helps produce some of the evidence off of which APR is based, and that's Dr. Stephen Samut. And he talked about a paper that he recently published with a using a rat model, using APR on a rat model, and how effective that was with them. And so he's just kind of building that case with evidence for the effectiveness and safety of APR. So I thought that was really cool.
Yeah.
Sorry, Dr. Bain, I'll let you talk.
No, I'm so glad you brought up Dr. Smoot. I was reading something the other day that his lab is actually working on in rats, trying to reimplant ectopic pregnancies, embryos into the uterus and look at survival. And so people like him really matter. And no, Miriam, I'm glad that you gave him a shout out because his research is so valuable.
Absolutely. And Dr. Samut will be speaking about that, right? At our Matthew Bulfin Educational Conference in February. So be sure to register if you want to attend that lecture. Registration deadline is in mid-February. So yeah, hopefully we will be able to see you guys there.
Yeah, I think for me, as I look back at the year, like Christina, I'm just grateful for the people who came and shared their stories and shared their experiences. You know, two that really stand out that are connected are Dr. Catherine Wheeler, one of our other board members who's in Colorado, who heads our Colorado AAPLOG chapter, and her experience as learning how to do abortions, being taught that that's how you help women when she was a resident, and her doing them until one day she realized, I'm not helping my maternal patient by doing abortions, and really sharing her story. And she's not the only one that's a member of APLOG now that are stepping out very courageously to share their stories of why induced abortion is not part of their practices anymore. So spending some time with her was very powerful. And I think connected to that was the patient, Leslie Wolbert, who talked about her experience in an abortion clinic years ago and the pain that she went through psychologically, but also physically with the experience and not having anyone to help her with the abortion. And it just brought to me how much hurt there is in this topic. And I care deeply. I have a heart for the women who I see at the 4 pregnancy centers where I work. As people may not know, is, you know, I used to do the full gamut of OB and deliver babies and do hysterectomies and pap smears, and now I'm just focused on unplanned pregnancies and the decision making and helping women feel empowered with information and provide them exceptional health care during that process. And it hurts me that so many women are not receiving exceptional health care, exceptional prenatal care, exceptional care during emergencies. We've seen over and over the stories where women are dying and they shouldn't be dying. We as a profession have to do a better job, like doing our job. And so, you know, Leslie's story really resonated with me as she shared that.
Absolutely. I was also really honored to be able to hear Leslie's and Aziri's stories, and that these women were able to be vulnerable for our audience. There's a lot of good takeaways there for medical professionals as we advance life-affirming care in service of women like them. Um, yeah, quickly moving on, we'll have plenty of time to give shout outs to our other interview guests because I just wanted to touch on one theme of several interviews that we had this past year, and that was the advocacy work of our leadership, of our members and our allies, who are all working together to promote life-affirming healthcare at the state and federal level, especially surrounding the elections this year and the state ballot initiatives that were up for a vote at at that time. So, what were some of your thoughts on those interviews, such as we had on Senator James Langford, Dr. Bain? You mentioned Catherine Wheeler. She spoke on her testimony as well as the advocacy work she was doing in her home state of Colorado. We had on our new director of advocacy and policy, Rebecca Weaver, to speak on advocacy, and we also, or you guys also, did a post-election review right after the election was over. So yeah, what were your thoughts on all of that?
Well, for me, I think I'm gonna give a little bit of a shout out to an amazing partner that APLOG has in the U.S. Senate, and that is Senator James Langford. There are so many members of Congress that have worked with APLOG and do amazing things, but I think this year Senator Langford truly showed his commitment to helping defend and promote life affirming medical care. And so I just would really like to thank Senator Langford for all of the work that he has done. And of course, this year, specifically on our podcast and with the work that APLOG is doing, we did a podcast episode with Senator Langford in the Senate podcast studio, which was pretty exciting to get to be there with him. But talking about the bill that he has authored and sponsored now for several sessions of Congress, the Conscience Protection Act. And I would encourage anybody who didn't watch that episode to go back and watch it, as we talked about the importance of conscience protections and not only maintaining the ones that we have, but actually strengthening them. And so we were able to talk about the importance of that bill, what led to him introducing that bill. And we're certainly hopeful that in the upcoming Congress that bill can move forward in a way that it never has before. So hopeful to do that, and we'll continue to give support to that bill through APLOG Action, our new C4. And then I also just want to thank Senator Langford. APLOG was able to appear before Congress a few times this year during hearings, and one of those was before the Senate Finance Committee, which Senator Langford sits on. And Senator Langford stayed in the committee hearing room, which is a bit unusual, actually, for the whole entire hearing, even though he had a lot on his plate that day. And we're so thankful for that, because him being there helped clarify the fact that state pro-life laws do not prevent physicians like Dr. Bain or I or any other physician from intervening and providing life-saving care to women when they're facing pregnancy complications. And he also helped clarify and ensure that we were able to get the message out there that actually life-affirming care is the best way to provide excellent health care to women and to their children. And so again, we have many amazing partners and advocates in the U.S. Congress and in state legislatures across the country. But I just wanted to take a moment here to just really thank Senator Langford and our other partners on a federal level who are advocating not only for our patients, but advocating for us as life-affirming medical professionals to ensure that we can continue to provide our patients with excellent care.
I think for me, as I reflect on that question, I'm so proud that APLOG Action exists. I'm the board chair for APLOG Action. You've mentioned Rebecca Weaver, our director. 2024 was the first year we existed, and I think we had a big impact, whether it was in the individual states with state ballot initiatives, endorsing legislation, being able to play an advisory role when bills were coming through and being asked our thoughts as the medical voice for the pro-life movement. I think having Rebecca come on board and her experience already in policy has been great leadership for us. And I just need to give a shout out to the APLOG members, maybe the soon-to-be APLOG members, who stepped out during this election in the states and let their voice be heard in a time where there is some fear associated because of some threats with conscious protection rights. But, we had over 1,000, isn't that right, across the states that had initiatives, physicians and other healthcare professionals who brought their voice out to really say why these state constitutional amendments, ballot initiatives, why they were harmful and dangerous for women. And uh, I am excited to see where that energy continues as we take back and restore our profession that has some people have tried to take away from us. So yeah, that's kind of my thought.
Absolutely. Yeah, this year we were really able to see the power of medical professionals like you guys and really what we can accomplish in this country when you guys are platformed, when we get to hear your perspectives and your expertise. You really have a lot to contribute, and this year really showed that for a lot of people. Yeah, one other theme that we had this past year is we interviewed a fair number of presenters for our upcoming Matthew Bulfin Educational Conference, both actually presenters who presented last year and upcoming presenters. So this year we had on Micheline Friedenberg, who spoke on reproductive grief care. We had on Tracy Windsor talking about perinatal counseling parents of children with prenatal diagnoses, and we had on a few more people as well. So, ladies, which of these interviews stood out to you, and what do you look forward to at MBEC?
Well, I will just say that for anyone who, I'm just going to talk about MBEC in general, our national conference that we co-host, the American College of Pediatricians, as you said, Miriam. For anyone listening to this who has never been to our conference, I would highly encourage you to come to this conference. One thing we hear over and over again, and this was certainly my experience the first time I attended one of our conferences, I believe it was back in 2015. But one thing we hear over and over again is that people are blown away by two things. One, the level of academics of the presentations and how thorough they are, how much people learn about things that they had not learned about before, not just related to abortion, but even bioethics, how we view our profession of medicine. So that comes up over and over again. And then the other thing that comes up is how refreshing and encouraging it is to be there and network with so many other like-minded medical professionals and people realizing that they are not alone. And I think this is particularly pertinent for our students and residents who attend on scholarship to our conference. And so I would just highly encourage, I'm really excited about the presentations that we have at this year's conference that's coming up, as Miriam said, at the end of February, and people can go to conference.applog.org if they want to find out more information. But I would just say that I think one of the most exciting things that we've had on the podcast are some speakers, and I know Susan's going to talk about some that she interviewed, but getting to hear just little teasers of what they're going to talk about at our conference. And so it's really exciting for us. The other thing that we do at the conference is do more podcast interviews. So at this year's conference, we will be producing content for this podcast where we get to talk with some of the folks that are at the conference, whether they be speakers or attendees, so that we can continue to access just this wealth of experience and information that we have represented at the conference. So I can't speak, I know I'm a bit biased as the CEO, but I can't speak highly enough of this conference. I just would really encourage anyone who's feeling burnout maybe in their practice, or feeling very alone, or feeling like they need more information to be able to defend life in their practice, I would highly encourage you to attend. Plus the fact that it's in sunny Orlando, Florida in the middle of winter. So for those of us who are in the Midwest and deal with those dreary winters, it'll be a good chance to escape. It's over a weekend. You'd only have to take really one day away from your practice. So I'd encourage everyone to attend. But Susan, I know you had the opportunity to interview some of our speakers, and what were your thoughts on that?
Yeah, I think I really have two thoughts. The first is, the conference is this year, the name is The Way of Medicine. And Dr. Far Curlin and Dr. Chris Tollefson, who wrote a book called The Way of Medicine. Dr. Curlin is an internal medicine doctor focusing on palliative care medicine at Duke, and Dr. Tollefson is a PhD and I believe in philosophy, but he is an ethicist. they're going to be speaking in the main conference, but they're also going to be doing a pre-conference workshop very much related to the ethics of medicine. I have had the pleasure of learning from both of them in the past. I completed a year-long program at Duke Divinity School in which on theology, medicine, and culture, where Dr. Curlin is one of the co-directors of. And wow, we are in for a treat because we have the opportunity to hear them multiple times. When I enrolled in that program, I knew what I believed, but I didn't know how to articulate it in the public square. And that program helped me so much. So if you're looking for gaining confidence in why you practice life affirming medicine, so like understanding the why of that question, but also how to share it, whether it's in written word or in interviews or around the table with your family or friends, um, come for the pre-conference day, which that's on Thursday, is that right?
Mm-hmm. Yep.
Yeah,
Yeah.
come for that because you will love that conversation. And then I think for me, one of the interviews that I did was related to the award-winning life-affirming reproductive health clinic that uh, Susan Rutherford and Helen Nyan. I hope I'm saying that right. I'm probably mispronouncing her last name. But I had the pleasure of interviewing both of them, and they are on the West Coast, and their center, their clinic practices life affirming medicine and is recognized by their patients as one of the best in that whole area. And so I think learning from them how to actually boots on the ground provide that care that we can incorporate in our own clinics, whether they're pregnancy centers or private practices or hospital based practices. I'm excited to get their insights.
Absolutely, absolutely. And I was honored to interview Dr. Robin Perucci, who is a neonatologist. She spoke on her work caring for infants at the cusp of viability, which was her topic from last year. But this upcoming year, she's going to be speaking on the perinatal concerns or the prenatal concerns clinic that she helps that she founded or the program that she founded at her hospital to help support parents of children with prenatal diagnoses. And she always has a really powerful perspective on the value of these children's lives and the importance of having medical support, of these families having medical support that is life affirming, that isn't just ushering them towards termination, but rather helping them aim for a trial of life for these babies. And so I'm really excited to hear her talk, and that topic will connect fairly well with the other interview that I did with Tracy Windsor of Be Not Afraid, who does pretty much that exact same type of work, but in terms of supporting families of children with prenatal diagnoses, but from a non-medical perspective. So she does more counseling and things like that. So yeah, that's been really great.
Absolutely. Well, and for anyone who has listened to Dr. Perucci or met her, they will know that she is such an amazing physician. I've often thought that if I were to ever have a baby who needed NICU care, she is definitely a doctor I want taking care of my baby. So I would encourage people, if they haven't listened to that episode, to listen. And again, another reason to register for MBEC, as Dr. Perucci will be giving a breakout talk. So, and she's just a very compassionate, compelling speaker to hear talk, and a wonderful advocate for life. So, yeah, so amazing year that we had with lots of good content. We, of course, didn't even scratch the surface really of all the content that we had this year, but I know we've got some exciting things planned for 2025 for this podcast. So, Miriam, what things do we have planned for 2025? Maybe some new things that we're gonna be doing with the podcast.
Absolutely. Yeah. Well, our main goal will be to keep giving you guys high quality content that's useful to you and useful to your practice. A couple of things that we'll be trying to focus on. One is the postpartum care series. Dr. Bain, you have so far hosted 2 episodes around the theme of postpartum care and supporting women in that. And we've gotten some good feedback on that series. And so I really want to make sure we hunker down and get a lot more guests that can help around that theme, that can offer insights around that theme, because that's a really important aspect of offering life-affirming care. Another thing that we wanted to help do more of is kind of rapid response type content. So there's a lot of news stories coming out surrounding, for example, cabinet nominations, presidential cabinet nominations, and there's always going on. So there's always something going on in politics and culture surrounding the theme of life-affirming healthcare, and we often get viewers and listeners who want to hear y'all's thoughts on that, the medical professional perspective, and so we'll really try and make sure to have more response type episodes that can help walk you guys through a lot of the things that are happening and how it connects to medical professionals' practice, life-affirming medical care. So those are 2 things that we hope to do more of next year. And I'd love to ask y'all's perspectives as leaders of AAPLOG. What's coming up for the organization as a whole? I know we mentioned MBEC, so that's definitely happening. What else are y'all looking forward to?
Well, I'll go, and then Susan, if you want to go. But yeah, I think this is going to be an exciting year, of course, for APLOG as we not only continue to serve as the medical voice for the pro-life movement, continue to serve as a support for all of our members who are providing life-affirming care in their practices each and every day and giving you all tools, hopefully, that will be helpful to you. But one of the things we really want to focus on as well is promoting showing, I guess, more than just what we're against. Of course, we're against induced abortion that ends the life of one of our patients and harms our other patient, but also talking about what we're for. We are for excellent healthcare for women. We are for flourishing for women. And so I think some of the things is, focusing on what are the benefits of pregnancy actually, and how can we come alongside of women to help them make healthy choices for themselves and for their children and promote really, like I said, health and flourishing for our patients, and showing women that choosing life is actually the best way forward for them and for their children. And so really kind of focusing on that and what can we do from a medical community perspective, but also from a policy perspective to better support our patients, to help them access better care, and things like that. So that's one of the things that we're looking forward to for 2025. Susan, what are your thoughts for where we're going this year?
Well, do you want sassy Susan or sweet Susan as I answer that question?
I think I want sassy Susan because she's my favorite.
I second that.
Well, as the chair for APLOG Action, I think there are a lot of inroads that we can make as we partner with the incoming administration from a federal level, but also, we're all over the United States as an organization, and we have members that can really impact at the state and local level. So I really think that courage is contagious motto of people starting to get out there and let their voice be heard locally, statewide, and nationally. And I do think I'm excited about opportunities that, given we are the medical voice for the pro-life movement, of how we can partner with the Department of Health and Human Services moving forward to do exactly what, Christina, you said needs to be done, which is access to high quality prenatal care for women, general women's health care, addressing barriers that we see that women, real barriers that prevent them from choosing life for their children. So socioeconomic factors, transportation, affordable housing, affordable child care, the list goes on and on of real world issues that have to be addressed. I'm fortunate in North Carolina, our legislation has put in our 97 pregnancy centers grant opportunities in the budget to actually have caseworkers, social workers, people with experience in the social work field to address real issues. In my center here in Wilson, we've had 5 women who are homeless. And if we can't help them get affordable housing, it's really difficult to say yes to an unplanned pregnancy. So I think we have a lot of opportunity to bring our expertise in a lot of different ways to new administrations that are happening all across our state.
Absolutely. Well, and I'll just add one other thing too, in that we will not give up our efforts to educate the public about the dangers of the abortion drug mifepristone, as well as calling for the FDA to be accountable for the harm that they have caused women by removing essential safeguards. And so that is a fight, even though our fight in the courts has ended for us, personally as an organization. Thankfully, there are states that are taking on that fight still through the court system, but we will continue to sound the alarm and ask and demand, really, of the FDA that they, at the very minimum, reinstate essential safeguards that will protect women from accessing these high risk and very dangerous drugs online with no medical supervision and really complete disregard for their health. And we will also continue to call for accountability amongst professional medical associations who are putting a political agenda of abortion on demand for any reason without any regulations ahead of good medical care and ahead of sound science. And so we will continue to push for those associations to be held accountable this year as well.
Absolutely.
I just want to add one other thing. I think for me, a place to build on that, Christina, is, we have 2 patients we care for, right? A maternal and a fetal patient. And when a woman chooses abortion, we know one of our patients is going to lose his or her life. AAPLOG really cares that our maternal patient doesn't also lose her life in that process. And that's the place we're coming from when Dr. Francis says, we have to keep women safe. And the regulations that got removed by the FDA really expose women to so many harms that we're hearing from them and seeing and in emergency rooms. And so, yeah, AAPLOG is in that fight. And we really want to make aware how women are being hurt and not protected as, yeah.
Absolutely. So we'll be doing a lot of educating the medical community and the public at large about how we'll continue to educate about induced abortion, abortion drugs, abortion pill reversal. In fact, we have a couple of medical education courses out for medical professionals. One of them is about abortion pill reversal. The other is about state-level abortion laws and how to practice excellent obstetric care in accordance with pro-life laws. So you guys can see those at meded.applog.org. They're available to physicians and hospital teams and more. So yeah, those are all things that we'll provide and continue to provide over the next year. And Dr. Bain, I love that you mentioned that being life affirming is not just being anti-abortion, and so I definitely look forward to continuing the work this coming year as we try and advocate for a holistic, life-affirming culture, both to the medical community and the policy sector and the public at large, the culture, and much more. So, ladies, great thoughts, and thank you so much for joining me here today.
Thank you.
Absolutely. And thank you to our audience for joining us here today as well. If you like this episode, feel free to give us a like on YouTube or a 5-star review if you're listening on a podcast app. I also want to be sure and thank our donors this year as we have closed out end of year giving for 2024. Thank you for all the support that you guys have offered to us. It's really what allows us to keep doing the work that we're doing, promoting life-affirming healthcare and life-affirming medicine. And so as we kick off 2025, I'd like to really encourage you guys to consider continuing to contribute to this project. If you'd like to make a donation today, definitely wouldn't complain, feel free to go to aaplog.org/donate. So thank you so much for being a part of this journey with us, and we look forward to seeing you guys on our next episode.